Good afternoon. My name is Latanya Smith. I am the Family Caregiver Support Specialist with Piedmont Tribe Regional Council Area Agency on Aging. And today I will be going over the Family Caregiver Support Program Request for Proposal 2025. The request for proposal can be found on the Piedmont Triad Regional Council website at ptrc.org. That's www.ptrc.org. Once you land on that home page, you're going to click on Aging Services. Once you click on Aging Services, down the left-hand side of the page, you're going to look for a tab called Partner Portal. You're going to click on the Partner Portal tab. You're going to come about not quite halfway down the page and look for about a third down the page and look for the Family Caregiver Support Program tab. Under that tab, it says FCSP Budget Program Proposals and Forms. And you will look at the very first item under that tab, and it says Family Caregiver Support Program RFP 2025. There also are other forms that will be necessary for the completion of your packet, but that's the area where you're going to find those forms. Be mindful when looking at the form and when downloading the form that at the bottom of pages 2 through 9, that it says FCSP RFP May 2025. If it does not say May 2025, if it says anything other than May 2025, you do not have the correct version of the proposal, and anything other than that version will not be considered. I'm sharing my screen, and we are going to go over the proposal page by page. The very first page that we are looking at is the organization checklist for FCSP request for proposal. Use the information on this checklist and in the appendices A and B to complete the Family Caregiver Support Program request for proposal. Mail all required documents, including this checklist, to the PTRC AAA address below, which is 1398 Carrollton Crossing Drive, Kernersville, North Carolina, 27284. The checklist will help you keep up with and make sure that you have all items for the packet and making sure that the packet is complete. So the information needs to be looked at very carefully and item by item. The first item is the provider name and county. The next one is the amount that the agency is requesting. And the third item is the cover letter. A cover letter must be included to state the request for Family Caregiver Support Program funds and how the applicant intends to implement the Family Caregiver Support Program. The RFP checklist is as follows. The request for proposal signature page to contain information about the agency, which is applying for funding. Every RFP and budget page must be initialized by the executive director. FCSP narrative plan and service categories are located in the appendices A and B, which are pages 7, 8, and 9. Group priority methodology is in Appendix A. FCSP budget form, submit pages 1 and 2 of the budget form. If both pages are not complete and submitted, they will not be considered. The FCSP proposal will not be considered if the budget pages are not complete and both pages submitted. And if it is applicable, copy of the subcontractor contract or purchase of service agreement. Mailing instructions. All community service organizations will complete and initial all documents, including this checklist. Do not include appendices when mailing the RFP package. The appendices, pages 7, 8, and 9 are for your own records. It does have an area at the bottom that says initial, but those 3 pages do not need to be submitted with the packet. Pages 7, 8, and 9 will not be submitted with the package. Mail the package to my attention, PTRC AAA Latanya Smith, 1398 Carrollton Crossing Drive, Kernersville, North Carolina, 27284. Upon completion of watching the video, there's also an attestation page that will need to be completed and submitted to me as well. That information will be on the proposal page. There will be a link for the attestation, and that just certifies that you have listened to and watched this information video. We'll be going to page 2, which is the family caregiver support request for proposal signature page. Information needed under this area will be the state fiscal year 2025, the organization name and address and phone number, the name of the executive director and email address, the program lead and email address if there is one, or if they are not in the same person. Grant responsibility of the funded agency, which is the person filling out the proposal. The agency administers the FCSP services using the FCSP funds allocated by the Piedmont Triad Regional Council Area Agency on Aging. Quarterly, the agency collaborates with the PTRC AAA and attends regional FCSP partner scheduled meetings, including conference calls and in-person meetings. The agency reports all partnerships, activities, and recommendations to the County Planning Committee. So quarterly, there will be Family Caregiver Support Program quarterly provider meetings, which are conducted by myself. Those meetings generally are in person, and occasionally there may be a Zoom meeting versus an in-person meeting. Those meetings generally take place here at PTRC in Kernersville. Also, the agency is expected to be represented in the county planning committee meetings where they would be able to report the status of the program for their area. So I was not only attending the quarterly provider meetings here, but also attending or having someone in attendance at the county planning committee meetings so that the area is aware of that current status of that program. Programmatic and budget change requests are submitted in writing for review and approval with the PTRC AAA using the FCSP budget revision form, which shall be dated and signed. Those revision forms will be found on your partner portal page, and those revision forms will come through PTRC for approval. So we will approve, or we will review and make the appropriate decision with the revisions that are submitted. The agency maintains the required consumer contribution forms and documentation as specified in the Division of Aging and Adult Services Manual, also now known as the DOA, as well as Consumer Contributions Policies and Procedures, February 2013. Those are items that will be looked at by the monitor once the monitoring season starts. So they'll be looking for consumer contribution forms and other forms that will be part of that monitoring process. The agency FCSP coordinator attends any existing county FCSP subcommittee meetings, and depending upon your particular county, those may or may not exist. Specifications of funding. Monthly, the agency will complete all data entry in the ARM system, keep accurate financial and programmatic records, and will accommodate other requests by the Piedmont Triad Regional Council Area Agency on Aging. Programmatic state mandated spending limits per client will not be exceeded. Example being the respite cap being $2,500 under category um, 5 in the program, category 4 in the program, excuse me. The North Carolina Family Caregiver Support Program logo will be placed on all literature and materials funded by the FCSP and part of whole. So if you are distributing marketing material, or if you're having a health fair and you have handouts, and those items are purchased or being supported by the FCSP funds, then we ask that a logo be appropriately placed in somewhere on that handout on those distribution items, or those handouts, if those are goodie bags or things that are placed inside of literature that you're going to be giving out. You want to have that FCSP logo somewhere, so that people are aware that we are supportive of that particular program and helping with that funding. Please review the RFP instructions in appendices A and B. Again, pages 7, 8, and 9 at the back of the RFP. Please contact the Piedmont Triad Regional Council Area Agency on Aging with questions at area code 336-904-0300. And my extension is 2021. My email address is lsmith@ptrc.org. Signature and date needs to be accompanied at this page at the bottom, to certify that the agency will comply with all the rules and regulations of the National Family Caregiver Support Program. Page 3, service category and narratives. Category 1, plan for information and outreach about services, and that includes service codes 811, 812, and 814. And narrative form, please explain the strategy your agency intends to use to provide informational educational programming in your county, and what is the plan to conduct outreach. That information needs to be put in the box, explaining how you plan to conduct your outreach, and what your intentions are with getting the information out, or how you intend to get that information out across your area. Category 2, plan for access to services, which includes service codes 821, 822, 823, and 824. As a best practice, a contact log should be maintained by all FCSP partners, regardless of whether or not service code 822, which is information and assistance, is funded. Indicate the number of calls and clients your agency anticipates funding for fiscal year 2025. And so even if you're not funding that code, if you keep a log, it's helpful when we are reporting to the state, when we're trying to provide information about the program in our region. You have your area's service codes here below. 822, information and assistance. There you are recording caregiver related calls, emails, social media, and a log that includes contact information and referral information as appropriate, and what your anticipated number of calls or clients that you will serve. That number would need to go in there, and anywhere that you are funding a service code, it asks for anticipated numbers in that last column. We ask that you please fill in those columns and complete that area. 823, caregiver resource consultation. Caregivers receiving categories 4 or 5 services will receive an assessment addressing their individualized needs. Clients are expected to be active in the development of their service plan, and it should be designed to best meet their needs. This code has been changed from care management and should be used to manage clients receiving categories 4 and 5 services. And this is not a long-term service. There again, anticipated number of calls and clients should be placed in the appropriate box. As well as at the top of page 4, 824, develop caregiver emergency preparedness plan. if this is something that you are going to fund, strategizing with caregivers to plan long-term, identifying backup supports and resources in the event of an acute incident or natural disaster. You want to indicate the numbers in terms of how many people that you think you will reach for this year in that category. Category number 3, action plan for caregiver counseling support groups training. This will include service codes 831, 832, 833, and 835. Agency must provide a combination of support groups, evidence-based groups like your powerful tools for caregiving and or educational classes, such as the use of the True Caregiver Education Learning Platform. Provide your agency's plan to deliver a combination of these services in narrative form in the box below. Be sure to include the anticipated number of classes for evidence-based programs, education programs, and the type and frequency of support programs. If service code 835, which is your caregiver training programs, is used, one offering must include disease-specific education sessions, evidence-based programs, powerful tools for caregiving, or something such as building better caregivers, etc. Note that service code 835 is for series-based training sessions. And in that box below, you want to include specifically what you're doing and how you're going to carry out that programming in this narrative box. Category 4, plan for respite. Category codes that will be offered to caregivers should be left blank. So if they're not being offered, they should be left blank. So if you're going to just only do community and program administration, that's the only thing you should complete on the in the area below, and all of the other areas should be left blank. Ensure all contracted agencies that will be providing respite services are listed in service agencies column, which is that middle column. Agencies providing respite must coordinate with Project CARE and serve as a liaison for lifespan respite. In order to be eligible for respite services through FCSP, the care recipient must meet the definition of frail as specified by the Older Americans Act. And below, we are looking at categories 841, which is your in-home, your community and program administration, your 842, which is your in-home respite hourly, your 843, which is community respite hourly, 846, residential facility respite hourly, 847, older relative caregivers day respite hourly, and 848, which is your older relative caregivers hourly respite. Please document any respite policies that your agency may have, including internal respite caps or one-time respite limits for caregivers, as well as project care coordination. It is recommended that vouchers have an expiration date of 60 days or less. And you want to make sure that you put all of that in your narrative below. Category 5, plan for supplemental services. For this category, the care recipient must meet the definition of frail as specified by the Older Americans Act. In red, it says no more than 20% of the budget can be for supplemental services. That is per agency in each county. So the 20% cap on that budget is for your agency and not for your county. So if there's 3 agencies in the county doing supplemental services, each county will be held to that each agency will be held to that 20% cap. So if there are more than one agency in the county, each agency is responsible for making sure that their budget is not over that 20% cap when it comes to supplying supplemental services. We will be looking at that when the proposal is submitted, and we also will be looking at that if anyone during the fiscal year requests to have a revision done. We are not going to approve any revisions that will put that particular agency over the 20% budget cap for supplemental services. Every agency will be held to the 20% cap, regardless of how many agencies in the county or in the region are providing supplemental services. We are looking at it per agency, and we will not approve any revisions that put that agency over 20%, that 20% cap. As a best practice, agencies should provide at least one Category 5 service. Overall, budget cannot exceed that 20% for Category 5 services. Category codes that will not be offered to caregivers below should be left blank. The service categories under this, service codes under this category are 851, 853, 854, 855, 856, 857, 859, 860, 861, and 863. And if you look at the very last page of the appendices, which is page 9, it will go into more detail about each of the service categories under each of these service codes under this category 5 supplemental services. You want to include in your narrative how your agency will ensure that the FCSP clients are receiving temporary funding assistance and that funds will not duplicate or supplant any other existing services. So you want to be clear that this is, these services are temporary. These are not long-term services, and they're not duplicate services. Priority populations and targeting outreach. This information comes straight from the FCSP manual, page 9. And this is where you want to, in the narrative piece, where you want to describe how the needs of most economically and socially needed, with attention to low-income minority individuals, according to the Older Americans Act of 2020, will be prioritized in the delivery of these services. So in your narrative, you want to include the methodology to address meeting the service needs of each of the following service priority groups. That would include at-risk older adults, including those that are frail and at risk of residential facility placement, low income, socially isolated, historically underrepresented population, Native American elders, older adults with limited English proficiency, individuals living in rural communities, and lesbian, gay, bisexual, or transgender LGBT older adults. So you want to be very specific and clear and making sure you're using the verbiage that comes from the manual on page 9 on how you are going to target this particular or these particular populations, because we'll be looking at making sure that you're covering each of these particular areas in your narrative and making sure that everybody's included. Page 7 is Appendix A, which are your additional instructions. So if you get caught up on filling out certain areas of the RFP, your appendices on pages 7, 8, and 9 can give you a little more detail and clarity on what you need to put in those narratives in the RFP. Again, this is the priority populations and targeting outreach, which is what we just kind of mentioned on page 6. But this is the information in terms of what you want to make sure you are putting in and have added and included in your narratives for the RFP. The Family Caregiver Support Act further specifies that program give priority consideration to the following caregiver populations. And this is very important: persons in greatest social and economic need, with attention to low-income minority individuals. Greatest economic need means the need resulting from an income at or below poverty levels. Greatest social need means that the need is caused by non-economic factors, which include physical and mental disabilities, language barriers, and cultural, social, or geographical isolation, including isolation caused by racial or ethnic status that either restricts the ability of an individual to perform normal daily tasks or threatens the capacity of the individual to live independently. And older adults providing care to individuals with developmental disabilities. Other special populations for the FCSP include caregivers that are working outside the home and caregivers expending their own funds to pay for care recipient needs. So this gives you just some additional information and what that priority population and targeting outreach needs to include and to be aware of when writing your narratives. Also keeping in mind the eligibility. Individuals eligible for FCSP services fall into the following categories: family caregivers of older adults, which is a person of any age providing unpaid care for an older adult age 60 or older, or providing care to individuals with Alzheimer's disease or related dementia, or older adults as caregivers, which is a relative caregiver, not a parent, age 55 or older, living with and raising a relative child age 18 or under. A relative or parent, 55 or older, living with and raising an adult child age 19 to 59 with a disability. Note that there are special eligibility requirements for categories 4 and 5 services under FCSP. For these categories, the care recipient must meet the definition of frail as specified by the Older Americans Act, which would be your supplemental services and your respite. So they would need to meet this eligibility requirements that states unable to perform at least 2 activities of daily living without substantial human assistance, including verbal reminding, physical cueing or supervision. Activities of daily living are things such as your eating, dressing, bathing, toileting, transferring in and out of bed or chair, and ambulation, which is your walking and moving in the home without assistance. And another eligibility requirement would be due to a cognitive impairment or other mental impairment, or that person may behave in a manner that poses a serious health or safety hazard to that individual or another individual. Again, pages 7, 8, and 9, which shows the initial, does not need to be initial because we are not submitting these pages. And it says do not submit this page. Additional FCSP RFP instructions on here talking about your budget. No more than 20% of an applicant's FCSP budget can be allocated for Category 5 supplemental services. The 20% cap on supplemental services applies to the agency original state fiscal year FCSP budget, as well as to any revisions. There again, we will not be approving any revisions that put a agency in Category 5 over the 20% cap. 4 service categories are information, Category 1, assistance with access is Category 2, caregiver counseling / support groups and training is Category 3, and respite Category 4 should be provided in each county. Respite cap is $2,500 per instruction in the administrative letter. 1207, and this concludes your project care. And this letter comes directly from the Division of Aging and Adult Services. Respite care must be provided with the project care program must be verified with the Project Care program to ensure that the respite cap is not exceeding. So you want to be keeping in contact with those agencies or with that agency to make sure that no one is going over the cap. And if you need your contacts for that particular Project Care in your area, feel free to reach out to me for that information. Please include staff name, position, and any benefit expenses, which is your FICA, insurance, or retirement, using staff lines, and note part-time or full-time on your budget forms. And there again, there are 2 pages to the budget form. Both pages need to be completed to be accepted. Unit rates are needed for the unit-based services. Please indicate the number of clients estimated to be served. And remember, without a unit rate or client numbers, the FCSP budget cannot be processed. So if there are not unit rates on there or client numbers, I will be following up with you, because I'm going to be at a standstill with me being able to push your proposal along if I don't have the unit rates in the budget, or have it on the budget, and that is indicated there that I can see it. So if you have the unit rate and you didn't write it in, I can't see it. It needs to be on the budget. Therefore, I can't process the RFP because the budget's not complete. If outside services or agencies are listed on pages 4 and 5 of the RFP, either as a subcontract or purchase of service, please include their names and descriptions on the FCSP budget form. If using either a subcontract or purchase of service agency, please send a copy of the contract or POS agreement with the submitted RFP, along with a copy of the agency's current in-home aid license. Again, if all of that stuff is not submitted with the packet cannot be processed. We can't approve it. We can't do anything until everything is complete. We will put that aside until everything is complete. So if you don't have pieces that come, if you have pieces that are missing when you send it in, I'm going to set it aside. I'm not even going to look at it, because what I'll do initially is to make sure everything is there. There again, there's initial. We're not initialing because why? We're not submitting page 7, 8, and 9. And page 9 is our last page, which shows all of your service codes in each category, which gives you a kind of more information, or specifies where it may not specify in the RFP about that particular service code. You're also able to look in your FCSP manual, and you're able to get detailed information about each of the service codes that are listed here. All of these codes are listed in your Family Caregiver Support Manual. As stated earlier, once you have watched the entire video or listened and watched the entire video, there is an attestation form that will need to be completed. That information, that attestation form, can be emailed to me, to my attention, or to my email address, or if you would like, you can print that form off, and then you can mail it in as well with your RFP. It's however you want to do it, but you can email me the attestation form to lsmith@ptrc, or you can put that form in the mail and mail it to me as well. That is the conclusion of the information session for the request for proposal for FCSP, Family Caregiver Support Program, fiscal year 2025. Again, if there are any questions, concerns, if you need any clarification, any additional information that was not covered in the information session, please feel free to reach out to me directly. Area code 336-904-0300, and my extension is 2021. Thank you, and have a great day.